The huge issue that we need to get involved in, and I know we're talking about it, is the healthcare accord. Because the healthcare accord is about all of our futures.
A health accord creates national standards. We don't have a health accord, we don't have national standards in healthcare anymore. It's a huge loss.
Make no mistake about it, the Harper Conservatives plan to dismantle public healthcare. They want to bleed it dry and leave privatization as the only option.
The one thing that stuck out in my mind the most about all of this was the speaker, Wendell Potter, and how he talks about these large American corporations that are waiting at our gates.
All they need is an opening to get in here to really ravage what you've got. You've got an amazing system that you need to work to protect.
I have a great deal of respect for Mr. Potter as an American to come and admit the shortcomings of the American medical system.
I think one of the hallmarks of the Canadian system is the fact that it's equitable. The U.S. healthcare system has one of the most inequitable systems in the world.
It's truly on us to spread the word, because the information that's coming from the government and their controlled media is misinformation. So there's a lot of people that have completely wrong ideas of what's actually happening.
We also need to talk to our MPs in the home areas. They are very surprised when they meet frontline healthcare workers. They take that as an anomaly. We do that very well as Unifor, as lobbyists, and as activists, because we are speaking from the heart.
We're prepared to do things much differently. Because you know what the issues are today in the healthcare sector? They're the same issues that have been around historically, and they're getting worse. Precarious jobs, part-time jobs, lack of benefits, lack of time, vacation, time off the job. We can start to walk through the whole list.
I think there are a lot of us in this room that can remember the day when we walked out of our workplace with a smile on our face, knowing that we had improved someone's life, even a little. Now you walk out doing a mental checklist as to what you haven't accomplished for the day, and that's not the healthcare system I want.
It's time to see some progress in healthcare. There should be no precarious work. I think we might have to go back to those days of getting outhouses put up and some fire barrels outside some of these workplaces, because by God, our members have had enough.
Coming to a conference like this, you understand we have things to discuss that are going to change the life of Canadians.
When you leave here today, the job of defending Medicare and the job of defending and fighting for your rights at work needs to kick into high gear. It's up to all of us to ensure that we don't go down the path of US-style healthcare. You're the folks that put care in healthcare, and you should be very proud of the work you do every single day for Canadians.